As cardiovascular disease remains the leading cause of death worldwide, understanding how to detect heart blockages before they cause fatal events has become critical. The growing awareness around heart health has sparked an increased interest in proactive measures to prevent heart attacks, particularly through early diagnosis of coronary artery disease, CAD. A heart blockage occurs when the coronary arteries, responsible for supplying oxygen-rich blood to the heart muscle, become narrowed or clogged, typically due to the buildup of cholesterol-laden plaques. When these arteries are blocked, the heart is deprived of oxygen, leading to conditions such as angina, chest pain, or more severely, a heart attack. Modern medicine offers various tools and tests that allow for the early detection of heart blockages, ranging from non-invasive screenings to more involved procedures that can pinpoint the exact location and severity of the issue. This approach has empowered millions to take control of their heart health and, more importantly, avoid the catastrophic consequences of an unexpected heart attack. Heart blockages do not always manifest obvious symptoms, making the condition both silent and dangerous. For many, the first sign of coronary artery disease might be a sudden, unexpected heart attack. The fact that heart disease often progresses silently emphasizes the need for regular screenings, especially for individuals with risk factors such as high cholesterol, high blood pressure, diabetes, a family history of heart disease, or a sedentary lifestyle. The process of a heart blockage starts with atherosclerosis, a condition where fatty deposits, known as plaques, accumulate on the inner walls of the coronary arteries. Over time, these plaques harden or rupture, restricting blood flow or triggering the formation of clots. When the flow of oxygenated blood to the heart muscle is reduced or blocked entirely, the muscle is starved of oxygen, leading to tissue damage or death, which presents itself as a heart attack. Given the prevalence of heart disease and the severity of heart attacks, there has been a growing shift toward preventive cardiology. This approach encourages early diagnosis and treatment of blockages before they cause irreversible damage. By catching the disease early, individuals can make lifestyle changes and receive appropriate medical interventions that drastically improve outcomes. One of the simplest and most commonly used tools for detecting heart problems is the electrocardiogram, ECG or EKG. This test measures the electrical activity of the heart and can reveal irregularities in heartbeat patterns that may signal underlying problems, including the possibility of blocked arteries. An ECG is typically performed as part of a routine heart health evaluation. Small sensors are placed on the chest, arms, and legs to detect the electrical impulses generated by the heart as it beats. These impulses are then displayed as a series of waves on a monitor or printed out for further analysis. If the heart's electrical activity is abnormal, it could indicate that the heart muscle is not receiving enough oxygen, suggesting the presence of a blockage. While an ECG is non-invasive and painless, it has limitations. It may not always detect blockages, especially if the heart is not under stress at the time of the test. However, it remains a crucial starting point in assessing heart health and identifying potential issues that warrant further investigation. To further investigate the possibility of a heart blockage, a stress test is often recommended. Unlike the ECG, which monitors the heart at rest, a stress test evaluates how the heart performs under physical exertion. The logic behind this test is straightforward. During exercise, the heart demands more oxygen, and if blockages are present, the limited blood flow will cause symptoms to emerge, such as chest pain, shortness of breath, or abnormal changes in the heart's electrical activity. During a typical stress test, patients are asked to walk or run on a treadmill or pedal a stationary bike while their heart rate, blood pressure, and ECG are closely monitored. As the intensity of the exercise increases, so does the heart's workload, revealing any areas where blood flow may be restricted. In some cases, a chemical stress test may be used for individuals unable to perform physical exercise. Medications are administered to simulate the effects of exercise by increasing the heart rate and mimicking the conditions that would arise during physical exertion. The stress test is a valuable diagnostic tool, especially for those who may be experiencing subtle or intermittent symptoms of heart disease. It provides a dynamic assessment of heart function, helping doctors identify areas of concern that may not be apparent through other tests performed at rest. Another powerful tool in detecting heart blockages is the echocardiogram, an imaging test that uses sound waves to create detailed images of the heart. Unlike the ECG, which focuses on electrical activity, the echocardiogram provides a visual assessment of the heart structure and function. The test allows doctors to see how the heart's chambers and valves are working and whether blood flow is being impeded by blockages. It is particularly useful in detecting damage caused by past heart attacks, as well as identifying any areas of the heart muscle that are not receiving adequate blood flow. During an echocardiogram, a small probe, transducer, is placed on the chest. The transducer emits high-frequency sound waves that bounce off the structures of the heart, creating images that are displayed on a monitor. These images can reveal abnormalities in heart function that may indicate the presence of blocked arteries, particularly if parts of the heart are moving abnormally or showing signs of weakness. Echocardiography is non-invasive and widely accessible, making it a commonly used diagnostic tool for evaluating heart blockages. It is often used in conjunction with other tests to build a comprehensive picture of heart health. Advances in imaging technology have revolutionized the ability to detect heart blockages, and one of the most significant developments is the cardiac CT scan. This test uses computed tomography, CT, to take detailed images of the coronary arteries, allowing doctors to assess the extent of plaque buildup and the potential for blockages. A specialized form of this scan, known as a coronary calcium scan, is particularly effective at identifying early signs of atherosclerosis by detecting calcium deposits in the artery walls. Calcium is a key component of the hardened plaques that form in arteries, and its presence is often an early warning sign of coronary artery disease. During a cardiac CT scan, patients lie on a table that slides into a donut-shaped machine. X-ray beams rotate around the body, capturing cross-sectional images of the heart and its blood vessels. These images are then reconstructed to provide a three-dimensional view of the coronary arteries, revealing any areas of narrowing or blockage. The cardiac CT scan is non-invasive and highly accurate, making it an excellent option for individuals with intermediate risk of heart disease. It can detect even silent blockages, those that have not yet caused symptoms, allowing for early intervention before a heart attack occurs. While non-invasive tests are invaluable for detecting heart blockages, the most definitive way to assess the severity of coronary artery disease is through cardiac catheterization, also known as coronary angiography. This invasive procedure involves threading a thin, flexible tube, catheter, through a blood vessel in the arm or groin and guiding it to the heart. Once in place, a contrast dye is injected into the coronary arteries, making them visible on X-ray images. Cardiac catheterization allows doctors to see exactly where blockages are located, how severe they are, and whether they are affecting blood flow to the heart muscle. It is often performed when other tests suggest the presence of significant blockages or when a patient is experiencing acute symptoms such as chest pain. The results of a cardiac catheterization can guide treatment decisions, such as whether a stent is needed to open a blocked artery or if more invasive procedures like coronary artery bypass surgery, CABG, are necessary. While cardiac catheterization is highly effective, it is also more invasive than other tests and carries certain risks, such as bleeding, infection, or damage to the blood vessels. However, in cases where heart blockages are suspected to be life-threatening, the benefits of this procedure far outweigh the risks. The early detection of heart blockages is crucial in preventing heart attacks and improving long-term heart health. With a wide array of diagnostic tools available today, individuals at risk for coronary artery disease have more options than ever to assess their heart health and take proactive steps to avoid life-threatening complications. However, detection is only the first step. For those diagnosed with coronary artery disease, treatment typically involves a combination of lifestyle changes, medications, and in some cases, procedures to open or bypass blocked arteries. Adopting a heart-healthy lifestyle, such as maintaining a balanced diet, exercising regularly, quitting smoking, and managing stress, plays a key role in preventing the progression of the disease and reducing the risk of a future heart attack. As the field of cardiology continues to evolve, new diagnostic techniques and treatments are being developed to further enhance the ability to detect and treat heart blockages. If you're concerned about heart health and want to take control before it's too late, early detection is key. Tests like ECGs, stress tests, echocardiograms, cardiac CT scans, and catheterization can help uncover potential blockages and prevent a heart attack. Don't wait for symptoms to appear. Proactive screening can save lives. If you found this information helpful, make sure to like, subscribe, and hit the notification bell so you never miss important health updates. Stay informed, stay proactive, and take charge of your heart health.